When it comes to mosquitoes, most Oak Parkers probably used to think of them as little more than a nuisance. But the appearance of the West Nile virus has changed attitudes and heightened awareness of the need to control this pesky disease-carrying insect. West Nile virus, which can only be transmitted to humans by the bite of an infected mosquito, was first detected in Illinois in the fall of 2001. The chance of being infected with the virus actually is very small. Less than 1% of mosquitoes are infected, and less than 1% of the people who are bitten by an infected mosquito will become severely ill. But illnesses do occur. Persons 50 years of age or older and those with weakened immune systems are most susceptible, along with those with chronic conditions such as heart disease and diabetes.
Of those who are bitten by an infected mosquito, most of those patients won't even become ill. People who do get ill will experience very mild symptoms, flu-like symptoms, which would be fever, headache, body aches. And that's typically at running about 3 days, 5 at the most. And they will resolve without any consequence. In rare cases, we do see severe symptoms that are of a neurologic nature. This would be a meningitis or encephalitis-like symptoms. These patients will experience more severe fever, worsening headaches, a stiff neck, and eventually confusion. Some of these cases progress to seizure activity, coma, and occasionally there are fatalities. So if some symptoms did occur that were more severe than mild flu-like symptoms, it would be reasonable and in fact recommended to seek advice from a healthcare professional.
The best way to prevent West Nile virus and other mosquito-borne illnesses is to reduce the number of mosquitoes and to take personal precautions to avoid mosquito bites. Mosquitoes lay their eggs in stagnant water. Weeds, tall grass, shrubbery, discarded tires, bird baths, depressions in the ground, clogged roof gutters, and even flat rooftops are all areas where mosquitoes can breed. Just by eliminating places that might collect water where mosquitoes can lay their eggs, individuals can take a major step toward reducing the mosquito population and lowering the risk of West Nile virus infection. Taking precautions to avoid getting bitten can help reduce the chance of exposure as well. Mosquitoes are most prevalent during dawn and dusk, so just by avoiding going outside during these periods or by making sure you are properly protected can greatly reduce the risk of getting bitten. Proper protection means wearing shoes, socks, long pants, and a long-sleeved shirt when outdoors. Mosquito repellents also can be effective. Just be sure to follow the manufacturer's directions for use on the label. You should use repellent even if you're only going outside for a few minutes. It only takes one bite to get West Nile virus. The most effective repellents contain DEET or picaridin. The American Academy of Pediatrics suggests using repellent with low concentrations of DEET on infants over 2 months old. When using repellent on an infant or child, apply it to your own hands and then rub them on your child, avoiding the eyes and mouth, and use it sparingly around the ears. Do not apply it to children's hands as they may put their hands in their mouth. There are no reported adverse health effects following use of repellents containing DEET by pregnant or breastfeeding women. West Nile virus is, indeed, an issue for concern, but remember, the chance of infection is extremely low for most people, and the chance of a severe infection is even lower. So don't let mosquitoes or the fear of West Nile virus spoil your summer. Just take a few precautions and your summer can be a great one.